Well, again, the side effects depend on the type of medication that the individual is taking. So say, for example, it's idiopathic pulmonary fibrosis, and the individual is either on pirfenidone, which is Esbriet, or nintedanib, which is Ofev. The side effects are basically the same for both of these medications, which is upset stomach, feeling kind of blah, nausea, there can be vomiting. But with pirfenidone or Esbriet, there is a higher tendency to get rashes, in particular have solar sensitivity, which means that the sun is not your best friend and you might get a very bad rash under the sun. So clearly wearing sunscreen, a hat, and usually the recommendation is to have a sunscreen that's greater than 35, somewhere around 50 SPF, and avoidance of the sun as well. So when an individual gets the nausea part of it, the poor appetite and feeling blah, the only thing that we can do is to reduce the dose and see if that helps, and definitely take the medication with a meal. That seems to help the upset stomach. With nintedanib, which is Ofev, as I indicated, a lot of these side effects are similar to pirfenidone or Esbriet, but nintedanib or Ofev has a tendency to give people loose bowel movements. And with the loose bowel movements, the medication itself comes with a kit that includes a medication to slow down bowel movements. It's called Lomotil. So the individual is free to take that particular medication. If that doesn't work, then we can reduce the dosage to the second level of dosing, which is 100 milligrams twice a day. The initial dosing is 150 milligrams twice a day. So those are some of the strategies. Both of these medications can irritate the liver, so that we make sure that a person gets a blood test done with a liver test on it at least once per month initially, and eventually when we see that nothing bad has happened to their liver, we are a little bit more liberal and do the blood testing maybe every other month or every 3 months.